Hi, my name is Pam King. This is my trusty sidekick, Danny. He's my son. I've been working with aggressive patients now for over 3 years. And no matter who you are, no matter what realm you're trending your career into, you have the potential of dealing with an aggressive patient. For my purposes, I'm going to be talking about the medical industry because that's the industry that I work in. But regardless if you're a teacher, medical professional, someone who's just caring for a sick loved one who might be having a reaction to medication, or a teenager, you might have the opportunity to utilize these skills that I'd like to show you today. One of the first things I'm going to show you, this is a little side note, no one ever showed me this or not told me this. I learned this by the School of Hard Knocks. If you see a situation increasing and someone getting aggressive, if you have long hair, take a moment just to put it up and take those earrings out. I learned that the hard way. No one ever told me. So, but I'm going to show you a couple of techniques. Your most important technique is your calming techniques. If you have a person who's getting aggressive, you want to stay calm yourself. Just the mere pitch of your voice has the power to escalate or to alleviate an aggressive situation. You also want to keep a safe distance. A safe distance would be leg length. That way, when you're dealing with an aggressive patient, you can still talk to them, communicate with them, but you can also see peripherally what they're doing. And that might give you the time that you need in order to get away. Another thing is you don't want to stand directly in front of that patient. That's a threatening stance, and you might want to just stand to the side, be a little bit less threatening to that patient. And also, if he starts coming towards you, you're not in his direct path. You want to know your patient, know what they're involved in, the things that they encounter every day. And if you've got someone who's becoming aggressive, you might just want to say, Danny, I see that you're getting upset. Would you like to go and sit down and talk about it? I know you had some visitors today. We can sit down and talk about anything that's bothering you. Most of the time, you're going to be able to get out of an aggressive situation by merely using those calming techniques. And the calmer you stay, the more you're going to be able to alleviate that situation. But sometimes that's just not enough, and your patient might actually come towards you in an attacking fashion. When that happens, if you've kept your distance, you can see what's going on and you can block that and get away. Let's do that a little faster. So you can block that and get away. If your patient, if you've taken your stances, you're using your calming techniques, it's not working, and your patient goes to kick you, before you kick me, the stance that you want to take in this is you want to guard as much of your body as you can. So you want to lean in, let them expose this area to them, keep your foot on the ground. That's going to keep you stable. So let's do that a little faster. You see it coming, so you can guard yourself from that. You don't want to have your leg up because that's going to cause you to fall over. You're going to lose control of the situation. Sometimes you might not even have a warning that your patient is getting upset. And when that happens, just remember, your weakest point in this kind of hold is between the thumb and the index finger. So you want to do what you can to break that hold. I'm going to move my elbow towards his arm and break that hold. Again, a little quicker. And then you have an opportunity to get away. You might have a situation where you're being held by both of your hands. It's the same principle here as well. These are the weakest points that you need to break free from. You just drop down and pull. Again, drop down and pull, and then get away. These are only a few techniques. There are many, many others. And I encourage you, no matter what walk of life you're going to go down, to refresh yourself on these. The more familiar you are with them, When you get in that situation, it's going to become second nature to you. You never know when you're going to run into an aggressive person. There are many others, like I said. I got these from Nicole Klaus, an RN, a BSN, and a clinical educational specialist. She has a great series on YouTube called Handling Aggressive Behaviors. It's a good idea to go at least once a year and go review these. You never know when these techniques might get you out of a sticky situation. Thank you.
Thank you, Danny.